Hello everyone, welcome back to my YouTube channel. This is Dr. Hausenberg Stark, and today I'm going to talk about uh, the mistakes that my colleagues and a lot of people, and even I at some point, uh, was making in my preparation phase of NEETPG, and of course, this is very much applicable for all the next students. Okay, so before I start this video, I would like to say something about all the entrance exams in general. You see, entrance exams, as far as a country like India is concerned, I've told you this multiple times that they are more related to elimination of population, right? Because there are so many candidates participating and they need to select a few people, right? Because the population is so much and the seats are very less. Okay, so this is the same thing. I mean, for IIT, for medical education, for everything. I mean, this is the gist of the things. Okay, so they can do this by two ways. Okay, one, they can make the exam very tough. Okay, or number two, they can just give you a normal exam. Both of them have their own pros and cons. For example, if you just talk about the engineering entrance exam, right? For example, the JEE mains and advanced. Okay, those question papers, those the kind of questions that come in those exams, right? They're very high level questions. Okay, even more advanced, that more advanced than the universities in the USA. Okay, they are at a higher level as compared to MIT as well, as far as their questions are concerned, right? So that is what the engineering platform does. Okay, but in medical platform, you have to understand that is not the case. you know uh, if we talk about AIMS, for that matter, AIMS is the top most institute for medical education. And as far as the NEET PG or the post graduation exam for AIMS is concerned, the NICT exam, right? It's not like it's very difficult or the paper is untouchable. It's not like that. The paper is something that anybody who has studied for NEET PG can attempt. Okay, but it's not like that for the engineering exams, right? For example, the JEE advanced paper is much more tougher than the AIEEE exam, right? People cannot even touch that paper. That is how tough it is. But that is not the case with the exam of INICT, for that matter. Okay, so what medical education has done is, the question paper is decent enough. Okay, it is something that is the questions are something that you are supposed to know as a medical graduate, right? They don't ask very high-fi stuff. They always ask basics. Okay, basics, clinical scenarios, and all these things. So where does the difference come down? Okay, the difference comes down between a person who doesn't make silly mistakes. Okay, he's going to get a seat. A person who doesn't make silly mistakes, number one. A person who can manage his own anxiety levels on the day of the exam and throughout his preparation. I always tell you, entrance exams, more than anything else, is a mind game. Okay, if you can manage your own mental peace, if you can just give your best output in terms of hours and in terms of quality, right? You're bound to crack a seat. There is no doubt about it, right? It is not about hard. It is definitely about hard work and all those things. But more important than that is to keep yourself sane, and to keep studying in the right direction. That's what is more important, and that is what will get you your rank as well. Okay, so they always keep asking you the basics. They always keep asking you some concepts which you're supposed to be aware of. Okay, and I'm telling you this again, that out of the people that sit for the exam, let's say 1,80,000 sat in this NEET PG. So out of that, approximately 60,000 people, uh, the the number of people who get qualified is close to 60-80,000. Among that, I think 40 or 30,000 people, they are aware of the concepts. Okay, they know the things that are being asked in the paper. Okay, but where do they lose their rank? Most of the people, at least the people within the ranks of let's say 2,000 to 10,000, right? The knowledge level is almost similar, right? But the difference comes in the smart work. Okay, which I'm about to tell you, the mistakes that people might make. It is not about their IQ. I'm in no way in a position to say ki a 10k student who's got a rank of 10k is any way inferior to the person who has got a rank of 1,000 or 2,000. Okay, maybe the person did not know how to do things. Okay, maybe the person did not have the right insight on what to do and what not to do. Okay, and that is exactly what I'm going to discuss, because if you have a wrong approach, if you run after the wrong things, that is going to cost you your rank. Okay, no matter how brilliant you are. Okay, so there are certain easy ways to do things, and that is what I'm going to discuss in this video. Okay, so the first thing that people do, be it your NEET PG or next, okay, they do not make the resource, they don't read the right things, I would say. Okay, they do not read the right things. What do I mean by reading the right things? You have to understand this. Anything you read, for that matter, it can be your standard books, it can be your guide, and it can be your Grey's Anatomy, it can be your Harper's for biochemistry, Robbins for pathology, Harrison for medicine, right? Excellent books, great books, no doubt about it. Okay, you're going to get a pool of knowledge in these books, right? But what is our goal? You have to understand this. Okay, right from the starting of our MBBS, what is our goal? Our goal is to clear this exam. Okay, and to progress our career further. Nobody is going to ask you your prof exam marks. I'm telling you this again. Be it if you're in a first year, second year, third year, final year, nobody gives a damn about your first year, second year, third year, final year exams. Only thing that people will ask you, if they ask you, is your NEETPG rank or your next exam rank, which college you're going to do your post graduation in, right? That is the kind of things that matter much more than your prof exam marks. ठीक है? So prof exams वैसे भी निकल जाएंगे, उसकी कोई दिक्कत नहीं है. तो what is difficult to crack is this, right? This is where the competition is, right? So you need to have a mindset of the fact that, this is my target. What is your target? To clear this exam. Okay, prof exams are not your target, please keep that in mind. Okay, now, of course, apart from clearing the exams, you have to be a good clinician. That is also very important. So what I believe is, as a human, right, as a human of average intelligence, my brain capacity, my ability to hold information at one point of time is limited. Okay, there is only limited amount of information that I can hold in my mind at one point. Okay, so if I read so many big huge books, right, how will I retain so much of information? That is not possible for a person like me. Okay, I have a very average mind, I have a very average IQ, I cannot remember so much. So you have to understand, instead of wasting your time reading so many things from so many books, right, I would advise you, this is you can mark my words. Okay, I always I'm a strong advocate of the fact that I'm about to tell you. I always read what I can revise, bus. Okay, दिस इज वॉट इज माई मेन सोर्स. आई विल ओनली एंड ओनली रीड वॉट आई कैन रिवाइज. मैं ऐसी कोई चीज़ नहीं पढ़ता हूँ जो मैं रिवाइज नहीं कर पाऊँ. ठीक है. सो फॉर एग्जाम्पल, आई न्यू दैट when it comes to clearing my NEET PG exam or next exam, I'm not going to read the books that I studied for my MBBS. I knew that. So I only read those books for the purpose of clearing my prof exams. The other things, like building my concepts, like going to the postings, learning clinical skills, all of that I did from coaching platforms. Because for me as a person, when a teacher who is at the top of his field already, when he teaches me concepts, when he tells me ki this is the way you are supposed to look at things, I get a picture in my mind, and using that picture I go back and I reference these books. Okay, and if there is something more to be added, I definitely add to my notes. So that is how you need to read. And at the end of 3.5 years or 4 years, you have to be ready with the knowledge of all the 90 subjects. मतलब अगर मैं आपसे कोई पेशेंट के बारे में पूछ रहा हूँ, लाइक अ जनरल पर्सन इज आस्किंग यू अबाउट सम पेशेंट, यू शुड हैव सम आइडिया अबाउट दैट पेशेंट. मतलब व्हाट इज द प्रेजेंटेशन ऑफ दैट पेशेंट, why is the symptom coming, and why, what can be the possible diagnosis, right? So that kind of a mindset you need to have by the end of 3.5 years of your medical education. And in the last year you need to revise and integrate things. So इसीलिए, why do you want to waste time reading things which you are not going to be able to revise, है ना? And I'll tell you the concept of memory. This is again wonderful. This is something Dr. Sachin from DAMS told me. It is a proven fact that instead of supposing I have a page to read in from Harrison, for that matter, I'm sitting with my book, okay, and I read that one page thoroughly for, let's say, 15-20 minutes. Okay, I'm just reading that one page for 20 minutes, so let's make it 1 hour. Okay, as opposed to I read that same page 3 times, okay, in, let's say, 10-15 minutes. What do you think will make me remember more things? Right, it is definitely 3 readings of short durations, because it is a known fact that one reading, no matter how much thoroughly you do it, it cannot retain more than 50% of information. This is a known fact for an average intelligence person. Okay, and no matter how fast you read something, you are definitely going to remember 33% of the information. So अगर मैं 3 reading दे रहा हूँ, okay, if I'm giving 3 readings of 15 minutes duration, 10 minutes duration, okay, I'm definitely going to remember much more than I would have remembered in one read. Right. So that is why I always emphasize on the fact that revision is much more important than spending so much time over one thing. okay, over multiple things. I always read only the things that I can revise. And as far as your prof exams are concerned, there are going to be some long questions. You can cover them from your main notebooks or from your textbooks basically, right? No doubt about it. But use short and crisp things to remember things, to build concepts, and to build your resource. Okay, by 3.5 years you should have something that you will know कि भाई ये पढ़ना है मुझे to crack the exam, right? So I have always focused more on my coaching, more on my notes than the standard textbooks, because I, as a person, first of all, I'm not a very good reader. I cannot read books properly. I don't know what is important, what is not important. I cannot build that clinical picture of the disease without somebody teaching me to it, teaching it to me, right? So I'm not somebody who can do that. So for me, coaching was a blessing. Somebody who knows the disease in and out, when he teaches you, when he gives you a complete perspective, you can go back to the books and look at the points that he might have missed, or that he might have just ignored, right? So always, I think it is better to learn from someone and then go back to the books, okay, and then add things that are relevant in your books, and finally in your notebook, and finally revise that notebook. Okay, don't look at the book again. I'm a very strong advocate of making notes. Okay, right. Now number two, again the same thing. There's this book called First Aid for USMLE. I've not read it per se properly. I've just seen the gist of it, and from what I've seen, it's wonderful. So for that matter, what I'm trying to tell you, why this means of first aid or coaching, is that you need a crisp resource. Okay, you need somebody who can build a picture for you, and then you can go back, read your standard textbooks. Okay, have I made this point clear? Right. So there is so much to read already. There are 19 subjects. You cannot know each and everything, right? You need to be focused. You need to be somebody who knows the things that he's supposed to know, right? So easily you have to make your resources very crisp and as precise as possible. Okay, yeah. So point number three, so I've highlighted here, I already told you about this, that revisions matter a lot more than the quantity of content that you have, right? I've already told you that NEETPG or even INICT for that matter, they only test you on your basic skills, on your emergency management, on what you have seen in the OPD and all these things, on the things that you're supposed to know, right? To just keep revising those things rather than running after Harrison and reading the whole book. Okay, it's very difficult. That is something that a medicine PG reads, right, when he focuses on one subject. So that is the importance of standard textbooks. Okay, so you need to revise your content, and that is why I told you it is much more important to build a crisp revision source, to build a crisp content that you will read for revising, right? Okay, and another thing, you see, again I would like to highlight this quote that my chemistry teacher in my नीट यूजी डेज यूज टू टेल मी. ही ऑलवेज यूज टू टेल कि मेडिकल में गधे जाते हैं और इंजीनियरिंग में घोड़े जाते हैं. इंजीनियरिंग का मतलब IIT MIT, ठीक है? सो इन आर मेडिकल फील्ड, राइट, even if I get a brilliant guy to sit for the exam, and if he just doesn't work, if he doesn't read enough, if he doesn't uh, give enough time to his books, he's not going to score well, right? Because no matter how intelligent you are, at the end of the day you have to remember so many things, you have to know so many things. Okay, it's not like you can solve a problem based on your intelligence or something like that. That is definitely a component, but what is more important is your hard work and smart work. Okay, this is definitely going to pay you off. Okay, so it doesn't matter if you're a if your colleagues, they can read, they can retain things in one reading. I had so many colleagues in my college who were much smarter than me in terms of reading things, right? They could just complete the entire chapters within 1 or 1.5 hours. I used to struggle with those things from textbooks, right? But I've scored better marks than them in NEET PG exam, and that is the reason. This is the reason. Okay, I was always a advocate of hard work and smart work. Okay, so it doesn't matter if your peers are smarter than you. Absolutely, it doesn't matter. What matters is, do you know what is coming in the exam and how to prepare about it? Okay, number four. Okay, this is a very important thing. You have to understand that at the end, this is towards the end, I'll make a separate video about this. What I want to highlight through this particular point is that your revision source that you need to make, you see, there are two things that you will do during your NEET PG exam preparation. Okay, you will make your notes, okay, of all the 19 subjects. Okay, but then these notes you will not be able to revise in the last 15 days of your exam. And this revision is very important because you have to understand this. If any of you are preparing for the exam already, you must have this feeling in the starting phase of your preparation, or even in the mid phase, or even right now you might be having this feeling. Okay, you give one grand test and you find that one or two subjects are weak. Okay, and then you read those subjects and then you give another grand test again, then other two subjects become weak, right? And if you keep doing that, you will never be able to come to a form where you know all the 19 subjects, the things that are asked properly. Do you understand what I'm saying? Okay, and that is only going to happen if you revise the entire syllabus 15 days prior to giving your test. Okay, so you need to be in touch with all the things that are commonly asked. Okay, this particular full revision that I've written is not reading your entire notes, 19 subject notes. No, it is about knowing the pyqs. Okay, pyq topics and the places where you commonly make mistakes in your grand tests. Okay, all right, apart from that, you need to have a revision source. I've talked about this in one of my videos. I'll just put that down in the description. Right, you need to make a small, sharp and crisp, high yielding revision resource, which is, let's say, about one book or two notebooks that you can revise in the last 15 days. Because if you don't do this, what is going to happen? You're going to make silly mistakes. And I'm telling you that it is not the content that you know, it is not the amount of knowledge that you have that cost you your rank. It is the silly mistakes that you make on the day of your exam. Take a lot of people ask me this question. You never used to get more than 135 correct in your grand tests. How did you make this leap of 156 correct? This is 21 questions. 21 questions का leap मारा मैंने. ठीक है? कैसे मारा? Because any grand test that I used to give, okay, any grand test that I used to give, I used to make at least 20 to 25 silly mistakes. By silly mistakes, I'm not saying it is just limited to not reading the question once. It is also including the things that I am supposed to have known, but I could not recall on that day because of lack of revision, because of lack of doing this. Right? That is again included in your silly mistakes. So I was pretty sure that if I don't do silly mistakes on the day of my exam, okay, if I'm able to keep my calm on the day of the exam, I'll easily be able to crack it. And that is what I did. Okay, so anybody can do this. You just have to stay calm. You have to understand the exam. You have to understand what the things are being asked, and you have to understand where your marks are going. My marks were going in my silly mistakes. Okay, there were things that I knew, there were topics that I knew, there were but I was not able to recall them. That was my issue. Okay, so I don't want you guys to make the same mistake. Okay, so make a revision source which you can revise in the last 15 days. That is going to drastically reduce your silly mistakes, and that is what happened with me. Okay, yes, point number 5, very important, already highlighted this. PYQs are extremely important because NEETPG for that matter is conducted by your NBE, and I think your next exam will also be conducted by the same board. So these people, they have a book, I think they have 3 or 4 books containing questions, okay, of all the subjects, and they keep asking questions from this book only. Okay, and this book is common for FMG also. Okay, so if you ask me the kind of papers that you need to revise for NEETPG or next, it is going to be NEETPG exam, of course, of the last, let's say, 3 years, 3 or 4 years. Okay, 3 years minimum. INICT 2 years, or 1 year also is enough, because INICT is a different board. And FMG papers, again, very important, because FMG and NEETPG is conducted by the same board. Okay, of the last 2 years. इसके ऊपर नहीं जाना. Okay, so this is the gist of the things. ठीक है, and the topics, of course, they are repeated because the question bank that they have is limited. समझ रहे हो बात को? ठीक है, and the last thing is reviewing your grand tests. If you want more information on this, I already have a video uploaded on my YouTube channel. Okay, yeah, I'll definitely put a link down in the description. Yes, again, I've told you this anxiety management part and the mindset part. Okay, I'll talk a little bit more about the mindset because this is extremely important. You see, what gives us anxiety during the exam, during preparation phase also, and this is particularly true for the droppers who are let's say having the second or third attempt this year in NEETPG 2022. Please understand one thing: life is not a race. Okay, it is not a race. Please, let's make this clear. Okay, especially if you live in a country like India. Okay, there are so many uncertainties. Okay, you don't know what answer you mark. There is no transparency regarding the exam. Okay, whatever result comes out, that is the result. You have to accept it. Okay, there is a 65% reservation that you also have to accept, and there are so many hard realities of our education system that you have to accept. ठीक है. So it is definitely not easy, it is definitely unpredictable. ठीक है. So it doesn't matter if you don't make it this time, it doesn't matter if you don't make it next time, it doesn't matter if you don't make it the other time also. What matters is at the end of your life, okay, you मतलब towards मतलब all in all what I'm trying to say is you just have to get there. It doesn't matter if you get there in 1 year, 2 years, 3 years, 4 years, or 5 years. ठीक है. uh, no, this might sound stupid, I mean, but this is the mindset that I always had, you know. If I had not got this rank, okay, I was prepared to take a drop. I was prepared to take a drop because even if I, if it was second attempt, it was my third attempt, I had this mindset of taking a drop. I know it's easy to say for me who's a fresher, and there are own pressures and other things with respect to people who are dropping. There are family pressures and other things, but I always had this mindset here. I mean, my only goal was to become a doctor, right? Who is the best in his field, okay? And I never gave a crap about how many years it would take me to get there, okay? 2 साल लगेंगे, 3 साल लगेंगे, I did not care about that. My goal was to reach to a place. Okay, I'll tell you this is something that is very close to my heart. I want to be a doctor. When I step into the hospital now, right, everybody should have a, you know, a sigh of relief on seeing my face, right? Any amount of panic going on in the ward, any amount of panic going on in my department, once I enter the hospital, the patients, right, my nurses, my staff, everybody should just relax and say ki yaar, this person is here now, okay, he will handle things. That is the kind of doctor I want to be. ओके जब मैं घुसूं वार्ड के अंदर, तो पेशेंट के चेहरे पे स्माइल आ जानी चाहिए कि यार डॉक्टर साहब आ गए देख लेंगे. ओके, आई एम गेटिंग द बेस्ट केयर दैट आई कैन. ओके, बिकॉज ही इज द बेस्ट. दैट इज द डॉक्टर आई वांट टू बी. एंड अंटिल दैट हैपेंस ना, आई एम नॉट गोइंग टू स्टॉप. एंड द सेम शुड बी योर माइंड सेट. ठीक है, इट डजेंट मैटर मैं 1 साल में निकाल रहा हूँ, 2 साल में निकाल रहा हूँ, 3 साल में निकाल रहा हूँ. नोबडी केयर्स ऑफ, नोबडी इज गोइंग टू आस्क योर एज कि आप कितने साल की हो और आप कितने साल आपने लगाया डॉक्टरी करने में. ठीक है, आपका कौन सा अटेम्प्ट था. अगर आपने एम से पीजी किया, मतलब आपने एम से पीजी किया, आपने मौलाना आज़ाद से किया, आपने मौलाना आज़ाद से किया. ठीक है, नोबडी आज सेकंड अटेम्प्ट में किया, थर्ड अटेम्प्ट में किया, डजेंट मैटर. ठीक है, हैव दिस माइंड सेट ऑफ वॉट यू वॉन्ट टू डू. इट डजेंट मैटर हाउ लॉन्ग इट टेक्स. ठीक है, एंड दिस इज एग्जैक्टली वॉट आई कॉल अ विनर्स माइंड सेट. ठीक है, अगर आप ऐसा सोचोगे ना कि मुझे इसी साल निकालना है, इस साल नहीं निकला तो मेरी जिंदगी खत्म है, तो आपके पास इतना प्रेशर एक चीज करने का, वो प्रेशर आपको रोकता है आगे जाने से, है ना. क्योंकि आप हमेशा सोचते हैं यार मैं फेल हो गया तो क्या होगा. यू कैन नॉट कंट्रोल दैट यार, है ना. कल को अगर कोई अनइवेंटफुल चीज हो जाती है ड्यूरिंग माई एग्जाम, मे बी आई वुड हैव हैड अ पैनिक अटैक. दैट कैन हैपन, इट्स वेरी नॉर्मल, राइट. तो व्हाट वुड हैव हैपेंड, माई रैंक वुड हैव गॉन डाउन, है ना. The reason I did not have anxiety breakdown, panic attack was that I knew कि अगर 1 साल ड्रॉप भी लेना पड़े, 2 साल लेना पड़े, 3 साल लेना पड़े, मुझे घंटा फर्क नहीं पड़ता है. I will eventually get where I want to be. And that is a mindset I want all of you guys to have. It is not a race. तुम 3 साल में करो, 4 साल में करो, बस पहुंच जाओ. ठीक है, और जिस दिन तुम पहुंच गए ना, यू वॉन्ट केयर एंड नो बडी एल्स विल केयर कि तुम्हें कितने साल लगे हैं पहुंचने में वहां पे. ठीक है, सो इट इज नॉट द एंड ऑफ लाइफ. You always have next year. It is not the end of life. Even if you don't get it that time, you always have next year after that. Okay, you just have to get there, and that is what you need to know. Okay, so with that in mind, I'm going to conclude this speech, okay, on this note. And you know, the reason you need to have this mindset is if you don't have it, you're going to get tons of anxiety building up inside you कि यार इस साल नहीं होगा तो क्या होगा, मेरा ऑलरेडी सेकंड ड्रॉप है, मेरी उम्र हो रही है, आई एम 26, आई एम 27, व्हाट विल आई डू. ओके, दैट इज गोइंग टू क्रिएट एंजाइटी एंड देन यू आर गोइंग टू मेक सिली मिस्टेक्स. और इससे बुरा कुछ नहीं होता लाइफ में, आई एम टेलिंग यू. When you come out of the exam and you see the question and you know this is the answer, but then when you realize you marked the wrong answer, it is the worst. Okay, and that will only happen when you go there with a calm mindset कि भाई ठीक है, मैं पहुंच जाऊंगा. 1 साल में पहुंचूं, 2 साल में पहुंचूं, 3 साल में पहुंचूं, घंटा फर्क नहीं पड़ता, मैं पहुंच जाऊंगा, मुझे पता है मेरे बारे में. ठीक है, that is a mindset, that is a mindset of a winner that you need to have. Okay, so thank you so much. I hope this video is beneficial to you. So please share this with your friends and let me know in the comment box if you want me to cover any other topics. Okay, thank you so much and goodbye and take care.